Welcome, 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 everyone. This is a special podcast. I was internationally traveling last week, so I could not join you guys with my regular time, and I apologize for that. But I wanted to get this topic out as fast as I could this week because, as you saw, the planes were flying over Germany this past weekend to announce a final countdown. And that really unnerved me. A final countdown of what? And of course, I knew exactly what they were talking about, but most of the world doesn't. So I want to tell you, this is going to be a unique podcast. And if you don't want to hear anything about a lot of stuff, a lot of truth, you should hang up, get off, leave now, because this is going to be a highly controversial podcast. Expected to be. But it is what it is. We have to call out what is going on. So the first thing I want to share with you today is some old information that you probably are aware of, but in case you're not, I need to prepare you for what I'm sharing with you on this podcast. And so we're going to start with some older information. And let me actually get this bigger so you guys can see. The first thing is this is an April 19th article from CNN World, as you can see at the top. Hunger and anger in Shanghai's unending lockdown nightmare. Now, you guys, I'm not making this up. You can go out and Google this yourself. You can see people in Shanghai jumping to their deaths because they are literally barricaded into their high rise. They're out of food. They're out of all kinds of necessities. This is back at the beginning of April, middle of April. So this is old information now, but I just want you to see what we're talking about here so that you can understand the depth of what is actually taking place in this world by stealth, quietly under the radar. And we as Americans cannot have this under the radar. So that's number one. We've got China. We know that people have been basically, here's another one. This is a video. I don't want to share the video with you because it is so shocking, but I will show this with you. It's from the Daily Beast. That's not a conservative, or it is probably more of a liberal publication, the Daily Beast. And you can see it reads, Shanghai residents scream from windows, fear starving to death over COVID-19 lockdowns. And there's a video, there are lots of videos. You can search the internet and find all kinds of videos out there about what is going on in Shanghai with their COVID zero policy. They have a COVID zero policy where they will shut down, lock down with one asymptomatic test, even an asymptomatic test, which we now know the science shows that there's not enough viral load to actually be infectious. But I know it's still out there that you can infect other people. That is actually scientifically inaccurate and false. There is not enough viral load for an asymptomatic person to get you the virus at the level it needs to be at. But anyways, so you understand that China has a COVID zero policy and has lockdown. I have talked to you multiple times about what kind of infrastructure bottleneck this is creating with hundreds of ships, oil tankers and cargo ships off the coast of Shanghai and other ports that have been shut down. So why am I talking to you about China? Why am I showing you a video this weekend from Germany with 5 planes spelling out in the sky the final countdown? What is all this going on? What is going on? And so let's get to it. So we have here the World Health Organization. And I just want to see if I can get this a little bit more. There we go. So we have here this World Health Organization, and we have starting this Sunday, May 22nd, through this coming Saturday, May 28th, the World Health Assembly agreeing to launch a process whereby they will amend, 194 countries will vote to amend the IHR, the International Health Regulations, which are promulgated by the World Health Organization, that all member countries, so those are the members of the World Health Organization, 194 members, all member countries vote on these amendments. So what are we talking about? What amendments? What meeting? What's going on? And so I do want to actually take some time to read to you this is a conservative publication, absolutely, but I want to read to you this conservative publication so that you can understand what exactly is happening. So the Biden administration basically promulgated changes to the rules of the IHR, the International Health Regulations that are binding on the World Health Organization members. So I'm going to read this to you. It's going to take a few seconds. On May 22nd through the 28th of 2022, the 75th World Health Assembly will convene at the United Nations headquarters in Geneva, Switzerland. This is beginning this Sunday, folks, in a few days. And with delegates from 194 nations to vote on Biden's administration. This is the Biden administration's proposed amendments to the IHR, the International Health Regulations, that will hand over national sovereignty and authority to the World Health Organization, which during the COVID pandemic carried the water for the CCP regarding the Wuhan lab. On January 18, 2022, officials from the Biden administration quietly sent over the WHO amendments without an official statement or a single press conference. These proposed amendments are written to strengthen the organization's ability to unilaterally, hear what I'm saying, to unilaterally intervene into the affairs of a nation merely suspected of having a health emergency of possible concern to other nations. If these amendments are approved, this coming meeting, the WHO, the World Health Organization, will have the power to declare an international health emergency, nullifying the powers of nation states. The U.S. proposed amendments to the World Health Organization and the IHR, the U.S. amendments will delete a critical existing restriction in the current regulations. The current regulations state the WHO, the World Health Organization, shall consult with and attempt to obtain verification from the state party in whose territory the event is allegedly occurring. This enables the Director General to declare health emergencies at will, and it will and can be used to justify ostracism and economic or financial actions against the targeted nation by other nations aligned with the WHO or who wish to harm or control the accused nation. The contents of the proposed amendments were not made public until April the 12th. The existing World Health Organizations provide for an 18-month grace period during which any nation may withdraw its yes vote for amendments. However, the current proposed amendments would reduce that opportunity to 6 months. So basically, they vote in the affirmative this coming May, and only 6 months will be given for any of these amendments to be retracted. If the amendments are passed, a majority of the nations could change their individual votes or reverse the approval again in the next 6 months. So COVID-19 make it the last pandemic. A report published by the United Nations in May of 2021 claims that the pandemic would have been prevented if the WHO had been given more global authority. The report states in its current form, the WHO does not possess such powers. To move on with the treaty, WHO therefore needs to be empowered financially and politically. The treaty should possess an adaptable incentive regime, including sanctions such as public reprimands, economic sanctions, or denial of benefits. On January 20, 2021, Joe Biden sent a letter to Antonio Guterres, the UN Secretary General, and member of the Portuguese Socialist Party, retracting President Donald Trump's withdrawal from the WHO. And they appointed Anthony Fauci, who's the head of the National Institute of Allergy and Infectious Disease, to represent the United Nations on the WHO Executive Committee. In March of 2020, the WHO pushed democratic nations to implement lockdowns, mandates, vaccine passports, digital health surveillance, etc. In fact, the WHO has developed guidance and even technical specifications for member states to adopt interoperable standards for COVID-19 vaccine passports. Labeled Interim Guidance, the WHO's latest release pushes new digital vaccine passports to be used on a global scale. The WHO openly states these personalized digital documents could be extended to capture vaccination status to protect against other diseases and may be used for continuity of care or as proof of vaccination for purposes other than healthcare, such as employment, university education, and international travel. This is a quote from the Liberty Counsel founder, Matt Staver. The Biden administration has now set America up to cede U.S. sovereignty concerning the health of Americans to the World Health Organization. Proposed amendments would give the WHO global jurisdiction over the United States, including the ability to declare national emergencies. We have already seen the abuse of power under the administration through the CDC during the last pandemic, and therefore we would have no recourse. So what am I talking about here? So you might be saying to yourself, oh, Rebecca, you just read me this article, but I am on the side of letting these things happen. I'm on the side of having this happen. But I just I want you to understand that you and I can't read flowery language that is written by the Biden administration for the WHO to be promulgated as opposed to the current IHRs, the International Health Regulations. They can make the language sound very flowery, but it is very clear on its face that what we are talking about here is the ending of American sovereignty. Now, you can say, but Rebecca, that's restricted to healthcare. But I want you to see what China is doing right now in the terms of healthcare. They have completely barricaded people in their residences for now going on a second month. Going on a third month since March. People are starving. People are jumping. It's horrendous. Everything touches healthcare. Everything touches healthcare. Travel, what your healthcare approach is going to be, whether you're going to force mandates. Now, we just had our United States Supreme Court rule that a healthcare mandate for an adult that they must take a vaccine was not constitutional. Unconstitutional. But when this gets passed, and I have every belief that this will pass, when this gets passed, it will be up to the WHO to tell the United States how we're going to handle the next pandemic. If a new vaccine, experimental or not, is going to be leveraged and who must take it, if you can travel, if you cannot travel. This is the total technocratization. This is the total digitization of everything we've been discussing for months and months and months. These digital passports that will be health passports, that will be travel passports, that will be identification passports. This is a digital global identity that they want you to have, that you will participate in, like it or not, that will basically your country will participate in, and that your country is just one member of 194 countries that answers and is accountable to the agreements that they set in place. And because these are amendments to a treaty that already exists, they do not have to have the 2/3 approval from the US Senate as they normally would. A whistleblower from the United Nations has come forward and stated publicly on the record that the World Health Organization will be used as the tip of the spear to bring us all into global governance. You guys know I've been telling you for a while that as we move, as countries move, China announced in September of last year, the UK announced in October of last year, Biden has already said as of this year, they all announced they're going to CBDCs, central bank digital currencies. So you have the UK on a central bank digital currency, you have Europe eventually on a central bank digital currency, you have China on it, you have America on a digital dollar. And all of these currencies digitally stored, right? Easy enough to, now you need to understand something about digital currencies in case you missed the other podcast. Digital currency means absolute and total knowledge of every financial transaction that you ever make. There is no more cash. There is no more putting cash in a birthday card. There is no more giving cash to whoever that you don't, that you want to give cash to. There's no more paying cash for your takeout. There's no more paying cash to, jump on in a cab. There's no more cash, period. There's no more cash. There is no cash. There's no ATMs. Everything is electronically tied to you by the central bank all of your spending and all of your income. And this really gets us to the Chinese model of a social credit system, because once the government, and obviously the Federal Reserve is not a government, it's private, but once the government has the ability to control your ability to receive funds and spend funds, then they can simply start to socially monitor you, track you. And if they don't like, there's a social credit score system in China. And if they don't like what you're doing, they will take away points that takes away your freedom, your ability to do things. And if they like what you're doing, or if you're fine, then you get those points added back. So this digitization of currency becomes autocratical. It becomes technocratic control, because everything you do is now known. There is no more privacy of any kind. And with the whistleblower coming forward from the United Nations stating that the WHO is going to leave the tip of the spear for global governance, it makes sense, right? From a logical perspective, we should start with a medical emergency. We do know that this pandemic impacted the world disparately all over, and the efforts weren't coordinated and all those things. And it's wonderful to have global coordination, global, scientific, relations, but does that mean that we need to have a global governing body that tells us what's right to do in the United States versus Europe? It's funny, Europe is large, right? And the United States is large. And I live on the East Coast, and I have lots of people that our clients live on the West Coast, right? What they do on the West Coast is not anything like what we do on the East Coast. And we know that about each other, and we're fine with it. We're good with it. So in a country the size of the United States, and in a group, a bloc is the size of Europe, France is very different than Germany, is very different than Spain, is very different than Italy. They're all different. We're different. We handle things different. We have different scientists. We don't have, you have to understand that as much as logical sense as this makes from a mental perspective, we should have global coordination. That does not mean that we should give up national sovereignty to some kind of global sovereignty. You give up your national sovereignty, and that is the end of all countries' autonomy as we know it to be. And I have to say, as an attorney, there is no authority for the legislative branch, for the executive branch, or the judicial branch under the United States Constitution to cede any authority to an international governing body. And I think passing this would be treasonous under the Constitution. So we have major things happening. The fact that it's not being covered in the media tells me all I need to know. It tells me that they want this to get through and pass without people knowing what's happening, without people realizing what's going on, because the second that the WHO has the authority to tell us how we're going to handle the next pandemic, and by the way, Corona's not over, as we see in China, they are completely locked down in Shanghai and other provinces with their zero COVID policy. The second that this passes and the WHO decides how it's going to deal with international healthcare crises, and which, by the way, are there any healthcare crises that are ever just country specific? Does anything stay self-contained in a country? Didn't we try to accomplish that with lockdowns and it didn't work? The whole world got it, and very quickly. So what I'm trying to tell you is, because of the traveling nature of the world in 2022, every healthcare emergency is an international healthcare emergency. If we could shut things down by locking down, then that would have worked in China. It would have worked everywhere else in the world that it was tried, and it hasn't. So any local healthcare emergency can become an international healthcare emergency and then implement the WHO. And that leads me to talk to you about what we've been talking about on FEMA. If you actually go, and I didn't screen capture it for you, but you can go and search FEMA right now. I'm just going to do it so that you will see that I'm not making this up. If you search FEMA and you type in green zones, FEMA and green zones, there is going to be, it's called shielding. It's called human shielding. So don't type in green zones, but type in human shielding. And that will bring you up to a FEMA guidance document that talks about the Federal Emergency Management Authority's plan to potentially shelter Americans in FEMA camps during coronavirus outbreaks. course, you guys know I'm on the East Coast. Senator Rick Scott, let's get his quote here. This is over the weekend before the conference begins. The WHO has served as this is his tweet, as you can see it on the screen here, I'm reading it. The WHO has served as a puppet for the Chinese Communist Party and helped Communist China cover up info on COVID-19. The Biden administration must not give this sham of a health agency national sovereignty over the United States and control over Americans' lives and health. World Health Assembly agrees to launch process to develop historic guidelines. So this is going to all come at us in the name of being for our benefit. It's going to come at us in the name of being for our own good, but it's going to look like China, potentially in FEMA camps. And it's going to be potentially the final countdown on global sovereignty at a national basis. We will have sovereignty no more, because understand that literally there is nothing that is not related to healthcare. Food is related to your body. Economics is related to the ability to do research and development, develop new pharmaceuticals and new therapeutics. Everything that the world touches healthcare, because we are human beings and we have to live and breathe and eat. And that means we have some kind of, need, physical need, and that involves healthcare. So the tie-in here to what China is doing to the World Health Organization's rules, it really bothers me and upsets me about Senator Scott's tweet right there, because Senator Scott knows very well that, and Senator Scott's from Florida and he's a Republican, he's a conservative, but Senator Scott knows very well that it's the Biden administration that promulgated the rules. Yet he's saying, he's literally in his tweet, literally saying, and I'll just bring it back up again, the WHO has served as a puppet. The Biden admin must not give this sham of a health agency national sovereignty over the United States and control over America's lives and health. The Biden administration is the one that wrote the amendments and submitted them to the WHO quietly. And they were only published on April 12th for the public to even see. We've only had literally less than a month to understand what the Biden administration has promulgated on these rules. So we must prepare for what is coming here. We must prepare for what is coming. And I'm going to give you the actual website now for the shielding. It's a CDC. It's by the CDC. And the content is the title is called Interim Operational Considerations for Implementing the Shielding Approach to Prevent COVID-19 Infections in Humanitarian Settings. This document presents considerations from the perspective of the U.S. Centers for Disease Control and Prevention for implementing shielding approach in humanitarian settings, outlining the guidance documents focused on camps, displaced populations, and low-resource settings. What is the shielding approach? The shielding approach aims to reduce the number of severe COVID-19 cases by limiting contact between individuals at a higher risk of developing severe disease, high risk, and the general population, low risk. High-risk individuals would be temporarily relocated to safe or green zones, and that's in quote, established at the household, neighborhood, camp, sector, or community level, depending on the context and setting. These people that are moved to these zones will have minimal contact with family members and other low-risk residents. So that is on the cdc.government's website. And again, the title for you to search for it is Interim Operational Considerations for Implementing the Shielding Approach to Prevent COVID-19 Infections in Humanitarian Settings. In other words, folks, we are talking about camps. FEMA camps at the direction of the WHO for high-risk potential cases. And you have to understand that these rules promulgated by the Biden administration to the World Health Organization Treaty of 194 countries that will be voting on this weekend, well, it goes from Sunday to Saturday, so over the course of the week, those people are voting to give the director of the World Health Organization the authority over each nation as to the remedy for the international health emergency and the tools and how to implement that remedy. This is the loss of national sovereignty. When you combine all of these things together, you combine a whistleblower from the UN, you combine the FEMA camps and the shielding approach that the CDC talked about, you combine the fact that China is already doing this and that Biden has produced these rules to cede authority in this era to the international governing body of the United Nations World Health Organization, you realize that this is the final countdown to countries' sovereignty and autonomy as we've known them to be forever. This, as a lawyer in the United States of America, has no authority in the Constitution, should be immediately a class action lawsuit, even if you think, well, Rebecca, it's all for our good, and they're not going to lock us down like they locked down China, and they're not going to do this, and they're not going to do that. You know, I have never heard of any kind of dictator that didn't deserve the name of dictator. In other words, when you give authority to people that supersedes their national sovereignty, it will be leveraged. It will be used. We already have the camps in place. We already have the CDC guidance in place. And now we're simply going to vote on the WHO. And then the WHO can be the bad guy, right? The WHO is the problem because they're the ones that told the whole world they have to do this, or otherwise no one's going to be safe. This is such a quagmire of legal mishmash problems. It's a class action lawsuit from the United States citizens. Every citizen should join the class action lawsuit and sue the federal government that signs off on these regulations. I have every belief that it will pass. And there should be an immediate class action lawsuit, not because nobody wants us to be safe or healthy, but because we in America should decide what we in America do. And people in France should decide what they do in France, and Italy and China and Japan and Australia, because the circumstances in this global world are very different, country to country, region to region, city to city. It's very different. And that doesn't mean we can't have coordination, but we certainly cannot have forced measures on sovereign people from an international governed body. Forced measures on sovereign people is where you start seeing, the United Nations vehicles coming through your country and telling you what to do because the WHO said so, and now they have the authority. This is the final countdown. This is the end of America and the world as we've known it to be. And if nobody says anything and the media is not even reporting on it, we'll probably just get a little byline that it passed. You need to prepare. You need to wake up and ask yourself, what is going on? What is going on? Because to me, it seems like a coordination event to have an event 201 in October of 19 where you pre-walk through a global pandemic. And then less than 6 months later, that actually comes to fruition. And then less than 2 years later, you're voting away your national sovereignty to the World Health Organization, while your internal documents indicate there are FEMA camps that could be leveraged, just like what's going on in China. And you start to say to yourself, when are we going to wake up and say, this is crazy? We want to be safe. We want to be healthy. We want to be a good citizen of the world and our country and our city and our community, our neighborhood, our town, our street. We want to be good citizens, but we do not accept that comes with the requirement that we are no longer free, that we are no longer a sovereign nation that decides what we do for ourselves, by ourselves, considering others always. We're a good country. We treat others well. We don't just say, who cares if this is going to hurt you? We're going to do it our way. We don't do that. We're not that way. That's not the case. We're the most charitable nation on earth. We fund more charities and international humanitarian regimes than any other country times about 5. You could take up the next 5 and add them together. They still wouldn't even touch what the United States does. So we do not accept losing our sovereignty in order to deal adequately with international health problems. And again, are there any health problems in 2022 that are not or could not be called international? So it's time to wake up, folks, because as you see, we are being pushed towards global governance at the health level, but the CDBCs, central bank digital currencies that are coming online, everything digitized, now you're completely controlled. Your income is controlled, your outcome is controlled. If they want to control it, of course, they'll tell you that it's just for your convenience. It's just for your convenience to have all of your medical information and all of your identification information and all of your health information and all of your voting information and all of your identity and all of your, that's all just convenience for you, right? Until you're in the system so far down the rabbit hole that you can't get out because there's no more cash. There's no more sovereignty. There's no more anything. And you wake up and you say, oh my God, how did the United States of America get taken over by global governing bodies that have nothing to do with the United States of America, nothing to do with the United States Constitution? This will pass. And when it does, the repercussions are going to be unbelievable. And I'm saying this to you now so that you can prepare for it, because we as Americans have to take back our sovereignty. We do not, and we are not beholden to the World Health Organization or the United Nations. We do not accept losing our sovereignty in order to be a good neighbor when it comes to dealing with health problems and health crises. That is not the cost of handling world health problems. It is not at the cost of the expense of national sovereignty, and our Constitution will not stand for it. So I can promise you as an attorney, after this passes, there will be class action lawsuit against the United States administration for unconstitutionally binding the United States government to be beholden to the World Health Organization. Until next week, you guys, wake up. We are in some kind of final countdown here, just like the planes said over Germany. Thank you guys. Take care.